On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Richard Ha, Dr. Jonathan O, Dr. Peter Beck, Dr. Clayton Frenzel.
Hello again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center.
This is a whole show dedicated to Forest Park Medical Centers and its amazing physicians.
Forest Park Medical Center, of course, one of the top medical centers in the entire Dallas-Fort Worth area, and we have a great show for you today.
We certainly do. Let's start off with our first Forest Park physician, plastic surgeon Dr. Richard Ha.
I weighed 485 pounds. I've lost a little over 300 pounds in a period of a little over 4 years. I did it without surgery. I just woke up one morning and decided I was tired of being the fat guy and decided I needed to make a change, and from that moment on, I changed it.
When we talk about massive weight loss, this is different than somebody who is on a post-pregnancy diet or lose some of that college weight. That's not the patient population I'm talking about. I'm talking about patients who have had massive weight loss. And these patients tend to do this in a very rapid way. This can be as a result of surgery. Likewise, some patients, some people can do that without needing surgery. The result on their skin and their body shape is oftentimes very similar. What happens is your body's metabolism and physiology is different. It changes. You have a deflationary effect. So whatever skin that you used to have in fat, just imagine the fat going away and the skin being left behind.
Dr. Ha is actually an acquaintance. His wife kind of grew up with my wife, and I had, as I was losing weight, had planned when I got to my goal that eventually I would meet up with him and get him to do the plastic surgery to take care of the extra skin from the weight loss.
With Mr. Winters, I was able to sit down with him and we came up with a very tailored, specific plan for him. His primary concern was around his trunk, his arms, and his breast. But we addressed all those areas through a comprehensive body lift, and his results are outstanding.
One of my favorite things to do is I road bike, and as I would bend over, you'd feel, especially in the abdominal area, you'd feel that skin as I was bent over biking. Now it's just a natural curve and feels normal. Dr. Ha is professional from the get-go. He's going to let you know what you're up against, how it's going to work, and the way it's going to all pan out. Everything that he told me in the very beginning is exactly how it went.
Mike, who loves his job working at a hospital, had chronic neck, shoulder, and back pain until he met Dr. Peter Beck. To find out more about Mike's story and other life-changing stories, log on to bestdocsnetwork.com.
I was at my fitness center and I was playing basketball, and I was reaching out to get the ball, and somebody's forehead actually slammed into the bridge of my nose and broke my nose immediately. I immediately knew I broke it because I heard a pop.
Often patients come in and have either seen previous doctors or oftentimes had previous surgery where it's been inadequate in assessing those outside parts of the nose. And so when we see the patients, we obviously take a very careful history from them and to do a careful examination. And if we determine that they have a problem in which the outside portion of the nose is contributing to their obstruction, that's typically when we recommend functional rhinoplasty.
I noticed that I was having breathing problems. Throughout the day, I would notice that I'm struggling to breathe, and especially at nighttime. While I'd be sleeping, I would wake up in the middle of the night sometimes and just gasp for breath, and I have never in my entire life had problems like that.
The surgery is highly individualized based on the patient's individual problems. It can last anywhere from an hour and a half to 4 or 5 hours sometimes, depending on the complexity of the problem and the patient's individual history. Have they had previous surgery? What types of collapse are they having? How much cartilage they have left over in their nose, and do we need to reconstruct that, possibly with even cartilage from elsewhere in the body?
After the surgery, I woke up and I had the splints, I had the bandages on the nose, so I was not able to actually breathe directly after the surgery. The recovery period, I think, was around 2 to 3 days for me.
Although there is some discomfort associated with the surgery, most patients by a week or two after surgery are very glad they've had it done. Not only are they breathing better, but they're pleased with the outside appearance of the nose.
A week after the surgery, he removed the splints and the bandages on the bridge of my nose. That's when I took my first breath. And I immediately knew that something has changed because I was breathing out of both nostrils, which I've never done before my entire life. It was a life-altering experience. I remember I was at his office and I was just so happy, and I think I gave Dr. Perro a hug.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
Up next, we'll meet Dr. Peter Beck, who has an innovative, non-invasive way to help individuals suffering from neck pain.
PSTIM is a lightweight device that's worn behind the ear and that sends electrical impulses to the ear, which help to reduce pain by causing the body to release its natural endorphins.
Well, I've had a bulging disc for a number of years, which has caused burning pain in my neck and upper back and shoulders. It's the type of thing that I, over the years, learned to simply accept because the only alternative was surgery, and I'm not yet ready to go that way.
Mike is a patient whom I've treated for neck pain. What he told me is that he has a bulging disc, which at this point does not require surgery. However, the pain in his neck prevents him from doing many things.
I wear it for 4 days, off for 3, wear it for 4 days, off for 2 weeks. Hopefully, if I need it again, it might be a month or 2 between treatments. Eventually, you'll get to where you don't need it at all. With me, the time without it is expanding.
This is the portion of the device that's worn behind the ear. The wires lead to the electrodes, which are right here, which are placed on the ear itself.
After years and years of chronic pain, Dr. Beck put this on one morning, and literally within 2 minutes, I felt a sense of relaxation washing over me. And within an hour, I started feeling more range of motion, and the pain now is such that I many times don't even notice it.
This is such a new technique to me. Every patient for whom I put this on, the first thing that people would state to me is that they have slept like they had never slept before.
Well, I think the biggest change that I've experienced is having more restful sleep. The PSTIM doesn't repair anything. If you have, in my case, a bulging disc or other problems, it's not going to repair that. It's going to make the pain more manageable. And the most attractive thing about the PSTIM for me was that if it doesn't work, the alternatives still exist. I've lost nothing by trying this. And in my case, it's been an amazing discovery.
Forest Park Medical Center prides themselves on being one of the top medical facilities in the Dallas-Fort Worth area. They also pride themselves on being a good neighbor because they are very active in the community.
We're here at the second annual Frisco North Texas Turkey Trot, and it's great to be part of it. We've about doubled the number of people participating this year from last year.
Forest Park Medical Center Frisco is one of the official sponsors here for the North Texas Turkey Trot. It goes to a great cause for the Miracle Leave of Frisco.
We're a youth sports organization here in Frisco for children with mental and physical disabilities. This is one of our fundraisers, annual fundraisers, and it benefits our organization. It gives our kids an opportunity to participate in sports like the mainstream children do. We started 7 years ago with 40 kids. Now we have over 350 athletes participating.
All of our directors are here today participating along with a number of additional staff members that were off. So we're all out here, we got t-shirts on. We're all here to just help out with the great cause and to participate and work off some energy before we eat a bunch of turkey dinner tonight. For us, it's just nice to get out here and part of the community. It's right in our backyard, we're right across the street. So anything we can do to get Forest Park Frisco's name out there and seen is great for us.
Forest Park just opened up recently. They're doing wonderful. Great community partner, as you see out here. They want to be part of the community. They want to get engaged in the community, and we're really thankful to have them here. So a lot of things to be thankful for in Frisco.
Very excited about Forest Park. They've come in and jumped with both feet in with our turkey trot. This is our second annual turkey trot. The first one was last year, and we started out with 1,800 runners, which was double what we thought. And this year we doubled our number from last year. We think the partnership with Forest Park, U.S. Road Sports, Miracle League of Frisco only get bigger in the long run.
We're a growing community. We're only 50% built out. We're trying to grow fitness into our culture, into our community, in everything we do. And Forest Park coming online here in the last year, they jumped right in. They want to be part of that. They're promoting the health, they're promoting fitness, and just another great partnership.
It's always fun just to be out there and let people get to know who you are. You're also seeing the people that you could potentially be serving either now or in the future. So anytime you can get your face out there, they can see you, it's more personable, and they can, really get to relate to you and get to know them as a community.
Did you know that Forest Park Medical Center was voted as one of the top 100 places to work in the Dallas-Fort Worth area? Forest Park Medical Center received this honor for the second year in a row.
Well, I woke up one day in early July, about 3 years ago, and had a small lump on my neck that I thought was an ingrown hair or something like that. But it continued to get bigger and bigger over the next several weeks. And that prompted me to see my regular doctor. So I ended up seeing an ENT, which he ran some tests. A week later, he diagnosed the cancer. I decided I need a second opinion, and I ended up in Dr. Andy Chung's office.
We sat down, I kind of discussed with him what I believe was going on. He had already had a needle biopsy of the neck mass, which confirmed that it was a metastatic malignancy called a squamous cell carcinoma. And he asked me what options he had, aside from getting radiation and chemotherapy, which he was very concerned about.
Hearing the word cancer is something you only think happens on TV or to someone in the paper, but when it happens to you, it is pretty scary.
I talked to him about a minimally invasive surgical option where I described how we could go in and remove the cancer in the back of his tongue, literally with no incisions.
The tumor on my tongue was fairly large, and when I saw a picture of it, it looked like a great big mushroom cap way back in the back.
You can see this is the lymph node on the left neck that Mr. McNeff noticed. After surgery, we repeated this scan, and what you see now is that this bright orange mass that was in the back of his tongue is no longer there. So you can see that that tumor is completely gone based on the PET CT.
It seemed like I recovered pretty much from the surgery in a matter of days. The worst part of this whole procedure was the radiation treatment.
Our goal is to preserve speech, respiration, and swallowing. And I think because of that and that preservation, patients are recovering quicker, and the potential complications are significantly reduced.
Ann was suffering from severe sinus problems, and she credits Dr. Colin Perro for helping change her life. To find out more about Ann's story and other life-changing stories, log on to bestdocsnetwork.com.
I had back pain, I had neck and shoulder pain, and my breasts were large, and it made wearing certain styles of clothing just undoable. Over the years, I've gone to physical therapy for my back and neck and shoulder pain. and it would help for a while. And then after a while, it would just go back to the old, same old, same old. And I've taken muscle relaxants, and I would take prescription pain medicine and over-the-counter pain medicines, and it was just not working for me.
Rosetta came to the office for a consultation for breast reduction surgery. She, for her tiny frame, she was very disproportionate. She's always had this, and she's been self-conscious of this since she was a teenager. I believe she was a G or an H, which affected her quality of life. She wasn't able to really engage in too many activities, sports activities, a lot of running or exercise, and she was having a lot of back and neck pain.
I ended up deciding that it was time to do something more permanent to alleviate the situation. And my primary care had recommended Dr. Angobaldo to me. And I went in to see him, and I immediately clicked with him and thought it was a good fit.
Breast reductions can help solve a lot of these symptoms that people are suffering from. Rosetta's surgery took about 4 hours to do, which included liposuction of her lateral breast tissue and her axillary tissue. She has a very nice result. We removed 3 pounds, a little over 3 pounds of breast tissue. Just imagine if you had a heavy gold necklace with 3.5 pounds and you've been carrying it or wearing it for the last 20 years. So just having that reduction in weight was a huge benefit for her, and she felt it immediately.
I'm looking forward to the fashion options that I'll have now, and just looking proportioned, no more pain. I'm just really excited.
As always, for more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
Right, and Forest Park Medical Center and their fine physicians are dedicated in helping change people's lives, like our next Forest Park Medical Center doctor, Jonathan O.
Here are stages of cancer. Basically, stage is just a way of classifying how far the cancer is spread. And every disease type has their own way of staging things. So the staging for breast cancer is not going to be the same as staging for ovarian cancer, obviously, because it's completely different diseases. But that's generally what we're trying to do, is trying to get an idea of how advanced the cancer is. And once we know how advanced the cancer is, we can generally give people an idea of what the prognosis is. That's ultimately what's important. You're not so much worried about stage, you're more worried about, are you going to be able to cure this? So, and stage kind of gives us an idea of what the cure rate would be. For gynecologic cancer, after surgery and what we call adjuvant therapy, and adjuvant therapy will just be either chemotherapy or radiation after surgery, patients undergo what we call surveillance. And surveillance is just a fancy term for keeping a close eye on things. Typically, we have the patients come back in to the office anywhere from every 3 to every 6 months for an exam and blood work. We want to keep an eye on things to make sure that the disease doesn't come back. Chemotherapy is just a fancy term for medical therapy. Traditional chemotherapy is an IV infusion. So just like if you were to go to a hospital, you get an IV placed, and these are medications designed to help kill cancer cells. And for the most part, the way I describe it is it's very expensive, very well thought out poison. And it's poison that's designed to help kill cancer cells before it causes too much damage to normal cells. Length of treatment depends on the type of cancer the person has and the treatment option that they decided for. But usually it's about a 18-week treatment course. There's a number of trials that are ongoing through our research division that's based out of Mary Crowley here in Dallas. We have a number of clinical trials open for not just gynecologic tumors, but also breast cancers and multiple other disease sites. We have targeted therapies. We also have tumor-specific options, such as vaccines. So a lot of these tumor vaccines are created at the time of surgery, where samples of a person's tumor is sent to a lab, and this lab creates a vaccine targeted specifically against that person's tumor. That's something that's under clinical trials here in Dallas that I'm very actively participating in.
Brothers Brock and Brady experienced multiple injuries due to sports. They credit Dr. Stephen Michelson, who got them back in the game. To find out more about this story, log on to bestdocsnetwork.com. Time for our next Forest Park doctor. It is Dr. Clayton Frenzel, who explains how revisional bariatric surgery can help those that have had unsuccessful surgery in the past.
First of all, from a bariatric perspective, the procedures that I offer my patients are the gastric band, the gastric sleeve, the gastric bypass, and revisional surgery.
I had the lap band done in 2008, and everything was going pretty good for maybe the first year and a half. In 2010 is when it got really, really bad, where I couldn't hold much food down.
When a patient comes to me with these complaints, I usually recommend that we go ahead and convert them to another operation. And the most common operation I will convert them to is either the gastric sleeve or the gastric bypass after the band has been removed.
Dr. Frenzel's commercial had popped up maybe a week or two prior, so I headed to the website, looked him up. He was available for an appointment right away.
One of the issues that could come up if you try to convert the patient from the band to the sleeve is you're exchanging one restrictive procedure for another restrictive procedure and not adding a whole other component of weight loss.
We discussed the various different procedures that could be performed, and we decided on a gastric bypass, and that's what he performed on me to remove the band.
The patients just need to be educated very thoroughly about the options. The gastric bypass, in my opinion, the weight loss is probably going to be a little bit quicker, and at the end of a year and at the end of 5 years, I think the results will still be better than the conversion to the gastric sleeve. The patients still have to do their part. No surgery is going to do 100%. They still have to do their 40 or 50% to help get the weight off, meaning they're going to have to eat healthy, they're going to have to see the nutritionist, they're going to have to come see me in follow-up, they're going to have to exercise. It's a whole spectrum of things that have to come together. It's like a puzzle. All the pieces have to come together to be successful. The surgery is one piece of that puzzle.
I just feel now that I'm ready to climb Mount Everest, run my first marathon. I know all of this is possible prior to this procedure that was performed on me. I was really just trying to exist. I know my family needed me, and I know I needed to work to maintain the things that you have to have in life.
Today's Ask the Doctor comes from Jessica. She has a question for Dr. Brian Barnett. How does a fertility specialist work in conjunction with OB-GYNs?
We work with them on a regular basis. In fact, our two biggest referrals are previous patients and the local OB-GYN. So it's very common that when women try and start a family, they commonly go to their OB-GYN first, and they often initiate some of the workup. And if those patients are not able to conceive through their local OB-GYN, through basic treatments or require more advanced treatments, they then refer those patients over to us. But at Dallas IVF, we're a full-service infertility practice. We don't deliver babies anymore. Our goal is to get these couples pregnant in a timely manner, and then they return to their local OB-GYNs to initiate their prenatal care.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Why are people becoming more obese? Well, there's two things. There is the culprit, the knife and the fork, or is it the chair? Well, one of the things is that they've done studies, and they've shown actually our amount of food intake is decreasing or staying about the same since 1950. But what has changed since 1950 is our food source. We now have foods that have hormones in them, have antibiotics in them, and we have what's called a homogeneous sort of fat supply, a homogeneous sort of food, this genetically changed food. The next thing is that we definitely have decreased physical activity. One of the healthiest person 50, 60 years ago was a truck driver. Why? He loaded and unloaded this truck. Next thing is stress and distress. You think of times of World War I, World War II, people had to have a lot of stress or distress, so are we having more or less now? I don't know. Another cause of obesity in this country is drugs. It's estimated that at least 10% of all obesity is due to drugs. And what are some of these drugs? Well, particularly some of the antidepressive drugs. It affects the brain. And you change some of these receptors in the brain that give people a good feeling. So they want the good feeling more from food or what have you. One of the big things that controls somebody's weight is the brain. We all eat almost the same number of calories each year. The average American only puts on about a pound a year. How can you put on such a small amount of weight of just simply a pound or two a year when you eat almost 1 million calories a year? Because that's the brain, due to these feedback mechanisms from your body's sensors. One of the sensors things is the leptin, a incretin released by fat cells that goes to the brain that controls how much you eat. So it's pretty amazing how well God designed the body, that considering how many calories we eat a year, how little bit of weight we gain. The brain and the body have this fantastic feedback between the two to keep people's weight approximately the same when you consider they eat about 1 million calories a year.
I've been a member of a band called Master Bones Jangle, and the Voodoo Island Cannibals were actually a pirate band. There were several times in which I've had to miss entirely the ability to go out and play with the band that I'm in and enjoy those things. Not to mention the fact that several times, band aside, I've got a 3-year-old, and more often than not, I couldn't play with him, I couldn't pick him up, I couldn't interact with him. He would crawl up into bed with me and, you know, he'd say, "Daddy's sick," and he'd get his doctor kit out and try to make me feel better, but there's nothing you can do.
In this particular patient, she had multiple recurrent episodes of diverticulitis. Diverticulitis is an area where there are inflamed or infected pouches or outpouchings of the wall of the colon.
When I first came to see Dr. Macaluso, I was experiencing a lot of abdominal pain. This went on for quite some time until finally my primary care physician referred me to Dr. Macaluso.
The most common area to get diverticulitis is what's called the sigmoid colon, which is on the lower left side of the abdominal cavity and in the pelvic region above the suprapubic bone.
Unless you are having those kinds of pains, unless you are really understanding what kind of agony that is, you don't realize how good it is to simply not be in pain.
A lot of times this can be treated with medications such as antibiotics. However, if you continue to have multiple recurrent episodes of 3, 4, or 5 episodes of diverticulitis, or the attacks of diverticulitis become more frequent in time, these are the patients that we typically recommend they undergo a laparoscopic colectomy.
My recovery time was minimal at best. I was out of the hospital before the weekend was over and my surgery was on a Thursday.
The small incisions allow for quicker return to work, quicker return to normal activity.
I can actually bend down and play with my son and not worry about having to lay on my back to try to find relief from the pain. From the time in which I met him to the pre-surgery procedures, the post-surgery procedures, and then the follow-up thereafter, he's almost been like a friend. I would absolutely recommend him to anyone going through this.
That'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, one of the top medical centers in the entire Dallas-Fort Worth area. And the good news, Candace, for the fine folks wanting more information about Forest Park Medical Center and their great doctors, you can head to the website, bestdocsnetwork.com, click on the Forest Park tab.
That's right, with unsurpassed service, exemplary care, and the highest quality medical facility, prepared to have your expectations exceeded.
And if you have a question or comment for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com.
That's right, we'll see you next week.